time to come. So right now, if you look around Europe and if you look at the amount of cases per population, we're exactly mid-table. Unfortunately, we have one of the highest growth rates of the virus anywhere in Europe. And so what we're doing is we're saying, let's act now, let's act before we're closer to the top of that table and before we need to make much more serious restrictions. So
what's gone wrong? How did we get here?
I don't think it's a question of what's gone wrong. We're dealing with a vicious, deadly and highly contagious virus. And what's happening here is happening all over the world. In Europe, but further afield. We're seeing it in South Korea, in New Zealand and in other places. The broad pattern is there was a surge here and in many other places. Very harsh and restrictive measures were used. They worked.
And those measures were supposed to give us time to implement a system that would allow us to control the virus.
Yeah, I think that's fair.
We had that time, did we?
Yeah. Yes, and I think this is that. So controlling the virus is rapid testing and tracing. We had about 52,000 tests last week. We have a massive upswing in testing now. So we're doing testing right around the country for meat processing plants, for direct provision, for nursing homes. I'm meeting the HSE tomorrow to see how we can get quicker and quicker. We are increasing enforcement powers. The Minister for Justice and myself are working on that. And what we're doing now is saying we're going to take very targeted measures, not the broad and very severe measures that were taken in the past. We've learnt about this. We're moving quickly. In order to make sure that we get the schools open, in order to make sure we can get health services open, in order to save lives, and in order to protect jobs, because we all know that if we end up in a second serious national lockdown, the consequences personally for our communities and for our economy would be very, very serious.
You spoke about testing and tracing there. Why are we still trying to speed that process up? Surely that should have been properly in place by now.
Well, I don't think we'll ever stop trying to speed it up.
But we were talking about 24-hour turnarounds back in, I think, May, and we're still looking at 72 three-day turnarounds.
So the 3 day.
Why aren't we at 24-hour turnarounds?
So we are from someone getting a swab to getting a result. Has there been something of a lag when we saw an awful lot of cases appear very quickly? There has, and the HSE have been working very hard on that.
That was supposed to be the capacity.
So the capacity is there. The capacity is there for 100,000.
Yeah, we saw a slowdown.
We did. So the capacity is there for 100,000. That's what means we can respond and say we're doing all meat processing plants, all direct provision, all nursing homes. What we did see was a very low level for about a month, about 20 cases a day. In a matter of days, that shot up to many, many times that. We didn't have the resources in place to instantly respond to that. It did take 2 or 3 days longer.
Well, you knew factories were at risk at the time. For the last few months, you've known factories were at risk. The whole system was supposed to be agile and robust to respond to incidences like this, and yet, as you just said yourself, it didn't.
Well, it did. The system is agile. The system is robust.
But it slowed down.
It did slow down, and we are looking at making sure that doesn't happen. But if you compare us to some other countries, take New Zealand. New Zealand is held up as a paragon of success in all of this. New Zealand's target time is 5 days. Our target time is 3 days, and we're looking at reducing that. The HSE has done amazing work. One of the things that happened was with a very quick upswing, there weren't some of the clinicians in place to make the calls as quickly as we would have liked. Why? Because they're clinicians who were pulled from their own frontline work. They were rightly redeployed. However, the HSE is working on a more permanent system that doesn't require pulling other clinicians in.
When will that be in place?
Well, we're working on it right now. I'm meeting them tomorrow, and they're already making improvements to it. So
if there's another surge in the next week, will it be ready, or is it a month-long thing? Or
no, it's happening already. So there's a whole team in UCD has been stepped up. There's a team in UCC is being stepped up at the moment. So that capacity is being put in place very quickly. Would we have loved to have seen no lags when we saw the outbreaks in some of the Midlands? Sure. But as with every other country, we are learning as we go. And I think the HSE made a very reasonable decision to redeploy clinicians to their day jobs when the cases were low. And they pulled them back in quite quickly when the cases shot up.
OK. Long meeting of Cabinet earlier today. What went on?
So there was a very good meeting. I think it was probably three and a half hours. Because we're moving very quickly in terms of reacting to the public health advice, obviously there was time for all of Cabinet to look through the benefit advice, the memo. There was discussion around exactly how we would implement it and so forth. So broadly what we had coming out of that was unanimous agreement on the vast majority of recommendations that NEF had made, which we're now
unanimous
putting in
agreement
place.
sounds very friendly and collegial. Would that be a reasonable description of it, or was it more robust?
Well, so Cabinet is
I mean,
by
we've heard the
consensus.
talk of the arguments between the Taoiseach and the Taoiseach.
Well, sure,
that happen?
There'll always be arguments. I mean, we are asking the Irish people to do very serious things right across our country. We are acting to try and stop a national lockdown. I would be disappointed if members of Cabinet who are there to represent different views in our society, if I'm there to represent health, the Taoiseach is there to represent business and so forth, I would be worried if there wasn't robust debate. And there was robust debate. And as happens at Cabinet, there is a consensus decision that we've reached.
No, were you not? You were all there at Cabinet, but you weren't all there at the press conference. It was surprising to some that the Taoiseach wasn't there when he's been there at nearly all the press conferences so far.
Yeah,
is there anything to be read into that?
No, nothing at all. I can see how it might have looked like that, but no, absolutely nothing at all to be read from that. I mean, we were all at Cabinet. It would have been, I guess, a strange press conference to have 15 or 16 of us at the press conference.
The other thing is you're bringing in new justice measures around the Guards, and the Fine Gael Justice Minister wasn't there either. Anything to be read into that? No.
Well, she was on the call. She absolutely was, and
at the press conference.
No, Minister McEntee and I have been going back and forth over the last few days. What we want to do is we want to say, look, it's clearly no longer enough to say we need everyone to follow the guidelines. We all know that there are more and more house parties happening. And unfortunately, nobody wants to be the guy that says, stop the house parties. But unfortunately, the data that the public health doctors have is unambiguous and that it is causing a spread. And whilst maybe the people at these parties are not at risk themselves, although they could well be, it's entirely possible that they're then carrying the virus to people who are at risk. So the decision we've taken is to say, in cases like this, or in cases where we have bars that are clearly just not obeying the same guidelines that the vast majority of the country obey, we are moving from recommendation and guidelines to enforcement powers. And I think that's the right thing to do. And I think the public want to see that, because we are asking everybody to make sacrifices again and again and again. We can't have a situation where a very small group of people say, you know what, the sacrifices are for you,
so that's going to take legislation, is it not? That's going to take legislation,
it will require primary
which,
legislation,
as I understand it, won't be enacted until the Dáil returns, which is September the 15th. And yet these measures are supposed to be finished by September the 13th, no?
Well, we will take a look. The primary legislation obviously takes a bit of time, and we will be looking for the cooperation, obviously, across the political spectrum. The timing on that hasn't been worked out, but the message we're sending out is this, is that while the vast majority of people are complying, which is why we're still mid-table in Europe and not in a worse situation, we can't have a situation where a small number of people essentially thumb their nose at everybody else. And we're saying, look, from now on, we are as quickly as we can, we're going to bring in enforcement powers, and that does require primary legislation.
So all of this is to try and bring the incidence rate down, essentially, isn't it,
That's
in the
right.
country? So it takes a while for all the cases to process through the system, several weeks. Yet in 2 weeks' time, we're sending everybody back to school and to college.
Yeah.
Is there not a contrast there or a difficulty in all that?
No, I think this is exactly why we're acting now. So the measures that we, the state, take now and that we, the people, take now are to reduce community transmission. And the single best protection for the schools going back, which is still on track, and a core government priority, is reduced community transmission. That also, by the way, is the best protection for people in nursing homes, for people who may have underlying health conditions who are living at home. This is all about reducing community transmission and the prevalence in the community as low as possible.
And that's what the local lockdowns in Laois, Kildare and Offaly were supposed to do too. And seeing as we are where we are today, that obviously didn't have the effect that you were hoping it would have. Is there any situation where in 2 weeks' time you'll reconsider opening the schools?
Well, first of all,
is there an incidence rate? Is there a kind of high bar or anything like that that the government has even discussed or considered, or is it schools will reopen whatever happens?
So first of all, just on the 3 counties, it is not the case that the measures haven't had the desired effect. The measures are having the desired effect thanks to the work that the people in those 3 counties are doing. So a bit like the measures we've brought in now, Had we not acted when we did with those 3 counties, the situation would be much worse. If we didn't act now in terms of the measures we're bringing in today, the situation in 2 weeks or 2 months would be much worse, and we would be looking at a national lockdown. In terms of, is there a magic number for schools or for pubs or for anything else? There isn't. So the public health team, they look at a lot of different things. They look at the cases. They look at whether the cases are going up or down. They look at where the clusters are. They look at how much community transmission is going on and a lot of other factors. So that's why we have the Public Health Emergency Team and the Expert Advisory Group. So they can look at a lot of really quite complex information and then come up with the recommendations.
Briefly, there was a lot of discussion earlier today about over 70s and new measures to be brought in. From my reading of it, the new measures are essentially, limit your contact, stay indoors as much as possible. Is there anything that's actually new in it that they should be thinking about and considering?
Yeah, there was reporting today which was simply incorrect and scared a lot of people, a lot of elderly people. I was talking to colleagues, Oireachtas colleagues, they said they were getting a lot of phone calls from a lot of very worried and very angry people over the age of 70 saying, are we about to be locked into our homes? That is absolutely not the case. It was not the recommendation from NEVIT and it was not considered by government. Let me try and paraphrase the Chief Medical Officer when he was asked exactly this, because what you're asking is public health advice. Essentially, what he was saying is people who are vulnerable to this virus, be it based on age or an underlying condition, need to exercise very careful judgment over the next 26 days. The prevalence rate is higher than we want. We had it down to about 3 per 100,000. It's now up, I think, at 26 per 100,000. That is a rate that causes serious risk for people. It is in the community more than it was. And so the advice to people over 70, the advice to people who are more vulnerable to this is exercise caution. So, for example, if you are planning on going on a holiday, on a staycation, and you're over 70 or you have an underlying condition, there's no issue with that whatsoever, so long as you're limiting your social interactions where you are. And to be honest, everything I have seen shows that those who are more vulnerable to this have been very seriously following the guidelines. Really, it's a reiteration of that, to be very, very careful while the rate is where it is. Finally
and briefly, when we talked about the schools, can we talk about the Leaving Cert? You've seen over the last couple of days in some of the UK nations that they've essentially U-turned on the standardisation of results. Can the government here ensure that the results that will be provided to Leaving Cert students will be fair?
I can't comment on it. I'm sorry, I'm not trying to dodge it. I've been focused entirely on COVID and the measures today and looking at the prevalence. So I'm sure the Minister for Education or others could answer, but I'm not up to speed on what's going on. I've been focused entirely on COVID and trying to make sure we avoid a lockdown in the coming weeks, get the schools back. Part of my job is to make sure that the
none
of
that was discussed at Cabinet today, no?
No. Today was all about COVID. Part of my job is making sure that the students get back to primary school, get back to secondary school, and indeed further education and college. The issues on the Leaving Cert, they weren't discussed.
Okay, Minister Stephen Donnelly, thank you very much. Miriam.
Thanks very much for that. I'm now